Have you ever had a wound that was not healing no matter how much you tried and you could not understand what was exactly happening to you? These are the types of wounds that we have not come to understand what is really happening to your body, but they have names, they have a reason why they are there, and there is information you still need to know about them. And it's also estimated that 1 to 2% of people in developing countries have these chronic wounds that will not go away, but that's not all types of wounds. We also have acute wounds. All of these result in affecting about 40 million people, especially for the chronic wounds, and that's worldwide. So today we have an expert in studio, and we are here to understand what are wounds, what is really happening, and how best can you approach them. Should we go for herbs, or should we actually just really address them exactly how they are meant to be, because they're different types. It's not all wounds that are just a wound, as we may think about it. So you're welcome. I'm Viola Kusasira, and it's NTV Medical Matters. We are supported by Bill and Melinda Gates Foundation. A very good morning to you, and very good morning to you, our specialist. This is a wound specialist, and she's here to talk to us about these wounds and what really is happening when they are stuck on your body. So first and foremost, you can briefly introduce yourself, but then also tell us exactly what wounds are. Can we just think about them as just wounds, or are they actually really in special ways different?
Thank you so much. Good morning, fellow Ugandans. I'm the specialist, your girl Diana, for wounds, any kind of wound. Now, someone will be wondering, what is a wound? A wound is an opening on your skin. It can be a cut, it can be from diabetes, it can be an accident. An accident can be a road accident, it can be an injury at home, it can be a burn. Yeah? So wounds come from so many different ways. And we have an open wound, and then we also have closed wound.
Really?
Yeah.
I thought a wound is something open.
No. There are some wounds which will be under the skin.
Okay.
Like you'll be feeling pain under.
Yes.
And then you do not know why.
Oh.
And mostly those, we call them gangrene.
Oh.
And they're very dangerous. So when you happen to have any pain under the skin, and it has been there for some time, please do not say and be comfortable at home. Please seek for medical advice. Come to us, let's diagnose and see that it's just a wound under a small one, which can be treated with maybe medication, or which will need further interventions. Then we have an open wound. An open wound, obviously, someone will bleed. It will be painful. It will sometimes even get infected if not treated. So when you get such a wound, do not stay at home. Please consult us.
And so when you talk about wounds, we've just seen different types, and I didn't know about the ones that are actually under the skin. I mean, that's a bit unbelievable, you know. But for the wounds that are on the surface, on the skin, how can you categorize them? Are they all just wounds? Are they all similar, or are they actually different types of wounds that we need to know about?
Yeah, there are different types of wounds. Now, depending on the cause, like I said, we have wounds from accident. Someone can have a car accident and then they get a wound. They can get actually a wound which can lead to amputation if not attended to. Then we have like the burns. Like maybe if someone is at home and maybe it can be from fire, it can be from hot water. That is also a bruised wound. Then we also have wounds like from diabetes. People who are suffering from diabetes. So
if you have to categorize these wounds, because when I was doing my research, I just saw something about chronic wounds and about acute wounds. What's the difference between the two?
Now, acute wounds are wounds, say like the wound you've just gotten that very time, like wound from a car accident, wound from fire. Then chronic wound is like, it's more from the disease side. Someone can have maybe diabetes or any other disease that compromises the immunity, and then they have that illness of a disease, and then it goes on for years. Like wounds, I have met patients who tell me they've had wounds for over 5 years, over 10 years, and they told me they actually reach a time, dress themselves and go to work.
With the wound? With
the wound, yeah. But I am here to tell them that there is a solution.
Yeah.
You can heal completely and go do your work. Whether it is from diabetes, whether it is from any other illness, we work on those wounds and you do heal.
I have a question actually about the kind of wound. Why would a wound last 5 years even if you've received treatment? What really is happening?
Now what happens, You could be receiving treatment, maybe you could be taking drugs, but for antibiotics, but not treating the cause of the wound. Say if someone is diabetic, they need to be on the proper medication for diabetes, to manage the diabetes. And then when you have that wound, you need to consult me, the specialist, to help you work on the wound with proper medication. Like what we use, we do not just give you medication. We use VAC. Someone would be wondering what is VAC.
I'm wondering too.
Yeah. VAC is vacuum assisted closure. We have a machine that we use. It is a small machine, actually. It's very portable. There are even people we put on and they go to office with it. That machine helps the wound to heal faster. Someone would wonder how. Now, when we use that machine on the wound, it has some accessories that we first put on, like we clean and then put the accessories. And then it has a canister. Someone would call it a container, which receives the discharges. Any discharge in the wound, the machine pumps in pressure and it will take away any discharge from the wound, say like the blood, like the pus. And as it does that, it's granulating the tissues, say the wounds which are deep. That machine helps to fill up the depth with the tissues. So as it fills up, it also takes the discharges to the container. And it also reduces the edges of the wound. So the wound, which was very big, will become small. Then it also prevents the bleeding. It also prevents infection, since it's taking away the discharges. So that is the use of that machine. It's vacuum assisted closure. It helps on all kinds of wounds. Especially the deep wounds, the bed sores, like people who are bedridden in hospitals.
Yeah, I've come across one on our show here. And that was very bad, really sad actually to see. It was a child, you know, bed sores and all. Yeah, so when you talk about that kind of treatment, what other available treatments do we have? But also before we talk about the treatment at home, what can someone do? Someone is watching and they're wondering, I have this wound, you know, I've received every kind of medication. Where can they begin before they actually, if they, for example, cannot afford to come to you, what is there available for them to do at home? Home remedy.
Now, home remedy. What I would encourage anyone with a wound at home, first and foremost, you have to keep the wound clean.
How do you clean a painful wound?
Now, when the wound is painful, you can never manage it at home because not even yourself can touch it. You'll be in pain. So then immediately you have a painful wound, that is a serious wound. Maybe a small cut, if you're talking about a small cut, maybe from a razor blade or something, that one you would press, and maybe if it's bleeding a lot, you would wash your hands and press. You can have some surgical spirit at home. You could put some spirit to stop the bleeding. And then if it's big, obviously you go to hospital to get further treatment, like stitching.
When you speak about going to hospital, is this a case where you can go to any nearby clinic or wherever and they treat you? And this could also be the reason as to why when these people go to nearby clinics or hospitals, they stay with the wound for close to 5 years. So is it that any place can actually attend to your wound and you'll be okay?
No.
So clarify on that.
Not every place will attend to your wound. When you get a wound, kindly come to the consultant. Come to me, I will help you and you heal in a short time. Do not keep going to the clinic for dressing. A year goes, another year goes. You're risking that wound to infection. You're risking your life. If it is on the limb, you're risking it to amputation. Even if it is on the arm, you're risking it to amputation. You're even risking to sepsemia. That is infection in the blood. Infection in the blood? Yes.
And how detrimental is that?
Those are one of the complications which come with not treating the wound well.
That is just one of the complications. Yes. So what other complications are there if someone, for example, does not attend to their wound and they're just watching and they've had this wound on their leg for almost 2 years? What happens?
Now, if you do not treat your wound well, first of all, it will not heal. Mere fact that you have the wound which is not healing is disturbing.
Very disturbing, I can imagine, yeah.
Secondly, it will interfere with your work. You cannot go to work when you have a wound.
That's true.
Another way, it also smells. Some wounds smell, actually most of them smell, because they are discharging pus. Yeah? Then it will also get infection. The minute the wound has pus, it is infected. Yeah? So you'll keep going to the clinic, they'll give you antibiotics, but they're not treating the cause. So please come to us, let's treat the wound, you get healed, other than keeping on to taking antibiotics when you still have the wound. Then when you do not treat this wound, it will go from acute to chronic. Yeah? Then you can even get amputated. There are some patients who come and maybe the wound is so big, they didn't attend to it on time. And sincerely speaking, when there's nothing you can do, even when you put the machine, it won't work for them. Oh. Yeah. Especially those who get like toe. Someone can come with a toe, especially the diabetic patients. Maybe the toe is already infected, and you have part of the toe, and maybe put the machine on that wound to protect others, because also the machine helps on, it enhances the bleeding. So the blood vessels will be stimulated. Yeah.
Okay, so you mentioned something interesting about, you know, bed sores, and I would like to take you back there a bit. But the bed sores, okay, so one time I had a wound and I could not find a way to sleep. So I had to sleep anyway. I mean, I tried to stay awake, but I failed. And later on, I woke up and the bed sheet was stuck on my wound. So you can imagine the kind of pain I was in. And so for someone going through that, when you have bed sores or like the part that you use to sleep is where you actually have a wound, how do you navigate that kind of pain?
Now what we do for bed sores, first of all, bed sores come when someone lies on one side. Say in hospitals, we encourage medical people to turn patients every 2 hours, especially those attending to patients, maybe in ICU, HDU, patients who cannot walk. You must turn them every 2 hours. You turn to lateral right, lateral left, and then also to the back, and also to the abdomen if they can lie like that. But if they can't, you keep on the 3 positions. So you really have to even document and say that from 7 to 9 a.m. the patient was lying on the lateral right. Then this time the patient will turn to this, such that even the person who comes onto another shift can turn the patient to avoid bed sores. Because already someone is ill in the bed, and then they are not turned, and then they get a wound, so they are adding another disease to another. But also, there are times when the immunity is really compromised, that even when you turn, the immunity is compromised. There will be those bed sores. But we are trying to prevent them. We have some creams that we use on those small wounds that are starting, and they usually heal. We only apply and leave them open, so they heal, to avoid them from becoming bigger. But when they become bigger, like when you come to me as a specialist, we apply the vac, the machine. You can even turn to that part which the machine has, because after dressing it up, we can keep turning you such that you do not get another bed sore on another side. So that is how we are preventing bed sores.
You spoke about the immunity, and that's something very interesting. You know, when someone's, at what level does someone's immunity have to be for them to have multiple wounds or recurring wounds that will not heal? What are they missing exactly in their body?
Now it also depends on the underlying disease. We have different diseases. We have diabetes, we have hypertension, we have HIV, we have cancer, we have a lot. So it really depends on what someone is going through. So that is why when we are treating these patients, it is still a team. The patient may have a wound, but when they also need a physician, they have that underlying disease that they need a physician to treat. As the physician gives the treatment and also the nutritionist gives their diet, we all work together to see that this patient gets life. Okay.
So we shall talk about nutrition a little bit later. What should someone focus on eating and all that? But you talked a little bit about treatment earlier, and I would like to take you back to treatment. So what other available options are there for treatment? I have known penicillin. That's the only one that I know or have heard of. And so our viewers might also know only that. So what else is there available that someone should look out for? Or some would just take Panadol or something of that nature and just relax, you know, which I think is not right. So you can let us know what available treatments.
Okay, now the available treatments, Just like I mentioned before, that there are those small wounds where we have creams we only apply, leave them open and they heal. Then we also have dressings. Those dressings, they have antibiotics in. We have like Inadine, we have like Actizob. Actually, when you look at Inadine, it's medicated with iodine, yeah? So when you put it on a wound, it releases slowly it releases to the wound the medication which is in. So it prevents the infection. Then also Actizob, we usually use it on wounds that smell a lot. So you will find that when you put that, the wounds will not smell. Okay. Yeah. So there are so many different dressings that we use. But from dressings, if the wound is deep and serious, it will need vacuum-assisted closure, the machine, which will help to granulate tissues. Because see, if the wound has this depth, yeah, even when you dress for 10 years, no dressing will fill up the depth.
True.
So this machine has the pressure to pull the tissues, to granulate them.
Is that painful?
No, it's not. It's so lovely.
Okay.
It's like a massage.
I don't know. I don't know how lovely that would be.
I really tell my patients that I really feel pain.
Yeah.
That is why I really love this, because it is pain-free.
Oh.
It's like massage when I put it. And when we put it, it will be on you for like 5 days, yeah, or 7 days. Then we change. Like 3-4 sessions, people get well, depending on the size of the wound. Yeah, and then we stitch off, and then we go home.
If I cannot afford that, your machine, what should I go for? I'm still trying to figure out for somebody else that cannot afford that machine you're talking about.
Now, it may not be on affording, but it is on the intents of the wound, on how the wound is. Immediately the wound is big, you will need a vac. But we are human. I know it may be expensive, but I personally, my passion is in seeing people heal. There are even those I've worked on when they don't have money. Then there are those who start the process and then they can't afford to finish it. And then you just say, God, give me the grace to help. And you help them and they are well. So we usually talk. Money is there, yes, because it's an expense. We have things that we use and we just buy them, but we can still talk.
Okay, and so for a viewer who's at home using salt in warm water right now for their wound, how effective is that? Now,
that salt that they use, the one for cooking food, is not the ideal salt.
What? That's because what we know.
No, that salt is too much. It's not diluted.
Oh, yeah.
It's concentrated. They need to use like normal saline. Yeah?
What is that?
Normal saline, you see the drip when someone gets malaria?
Yeah.
Those drips that they put on you.
Is that ORS?
No. It's different. Okay. So normal saline, and it's not expensive.
Where do we find that?
Cheap. From pharmacy. But I do not advise people to self-medicate. But it's cheaper and it has salt that has been at least diluted. Yeah. So if someone could put on their gloves and clean a little to a small wound, and clean a little, and then they dress it up. A small wound, not a big wound.
Not a big wound.
Yeah.
Big wound, please do not tamper. Just
but also remember, a small wound can become a big wound.
Actually, a small wound can become, I've seen small wounds that are very deep, extremely deep, very small but very deep, like Bonyonyi.
Like when you have gangrene. Gangrene will be like a pimple here. But when you try to remove it, it will ooze out past too much. So it will be deep inside.
Oh, that thing. What is it called in Luganda though? I've forgotten.
Gangrene in Luganda.
The one they burn. They usually put a hot metal on that thing. It's usually looking yellow with pus and stuff like that.
Yeah, it's something like that.
Yeah.
It will be outside. Sometimes they're yellow. Yeah, it's like a boil.
Like
sometimes it's dark. Yeah. But please, I do not charge for everything. I won't care because I have passion for it. Yeah. I'll give you my number at the end. You can call me. You can send me the picture of the wound. I would look at it and I would advise and tell you whether it's for vac or just a dressing or just a cream. I would advise free of charge. Yeah.
Okay, so when someone has a wound and they've been dressed, you know, how do you then take care of yourself in terms of bathing or something of that nature? Because I understand also that I once had a dressing, but then water would get inside the wound, inside the dressing. How can you assist someone like that, or what should they know if they're watching?
Now what we do with that, when we've dressed the wound, and after putting our seals, we put what we call Primapo to protect the water from entering inside. Then after, if someone is going to be home, say, we put also crepe bandage around, such that the wound does not get swelled. Like those who are using VAC, we still do the same. But if the wound, there are some places which have the wound and you cannot really allow the patient to go bathe. For those ones, we usually do bed bath. Because it is short time, so I usually tell them, please, let's just wipe you in the bed until this is over. Give it 2-3 weeks. You've had it for 5 years. Give it a little time. You'll shower.
Yeah, you will shower later. Yeah. All right. So before we talk about stages of the wounds, which I'm inquisitive about, there is something that I've seen very common on people's fingers. Usually just swells and becomes yellow, and then maybe your nail will fall out or something will happen. Maybe it will heal, but do you understand that thing? What is it?
Yeah, that is like infection. Your nail gets underneath infection.
Yeah.
Yeah. And then if you do not hurry up to get treatment, the infection will eat all your nail, and even the nail will fall off. Yeah,
I've seen that. It's actually somewhere on Twitter. I wish I could remember who posted it, but it just has like a swollen finger, you know, and it happens a lot, like starts from the side, the corner of the nail, even though you've done nothing to your nails, but it just happens.
Is it the one locally called Ntunuka?
Yeah. That's the one.
Yeah. And I heard someone saying that when you happen to feel like that, you run to the toilet and you make sure, you know, there are so many leaves.
I saw that as well. I saw somebody tell someone to go to the toilet. Is that even real?
No. As a medic, I do not encourage that, because ideally that is an infection. An infection.
There were so many myths about it actually, and so I didn't think it was an infection. Had to bring it up.
It is an infection, and it's better if someone gets an antibiotic to treat it, and also to clean it up with normal saline.
Yeah, but I've seen people burning it. I've seen people burning it. I've also seen people burning those boils that I talked about earlier. You just let it grow and become big and yellow, and then you burn it. Have you heard of that?
I've heard about that, but really, it's so painful to burn.
To burn.
Yeah, it's so painful.
Okay, so let's talk about stages of wounds. Do wounds actually have stages? And if they do, what are those stages? But I don't think anybody would want to sit around and wait for stages of a wound, but tell us about it if it's there.
You know, some people wait.
To do what?
They say, let me clean up myself, dress it, I'll go next month. Then the months move, a year goes, when they haven't gotten treatment. So it becomes a chronic wound. I just encourage people who are seeing us, if you know of someone who has a wound, or if you have a wound, I'm here for free. I'll give you my number. Please get a WhatsApp phone if you don't have. Share with me the picture. Let me see the wound and let me advise. Yeah? If it is small, I'll still tell you what to use. If it is big, I'll still tell you what to use. If you don't have money, we shall still talk. The aim here is to heal wounds. Yeah.
The good specialist has given you an offer. Maybe it's a Christmas offer. So in case you have a wound or you're struggling with something chronic, feel free to reach out to her. We shall be talking about that later. But also you can follow our conversation on NTV at NTV Uganda social media platforms. That is X. We also stream live on X, and we shall be having a lot of these discussions here on Medical Matters. And let's continue. So this time around we shall be looking at the immunity. What can someone use in order to boost their immunity if they are really struggling with these wounds? There are people who have wounds that reoccur. They happen and go away. You always have something somewhere. I used to hear my mother say that I would ask one of my siblings, why do you always have those little things around? Like, what's happening? So please talk to us about what's happening with the immunity, but also what can be done to boost it to become better. Yeah.
Okay. Now, wounds go hand in hand with immunity. I encourage people to eat greens often. Yeah. To eat, like, grab a mango, an orange, lemon, Eat them often. Boost your immunity. Do not just feed on chips, chicken, yeah? You know, junk is also too much. Yeah. Should we revise the diet of our judges? Yeah? Could we eat those fresh things other than the processed foods? Yeah? They've caused us a lot of harm. Yeah? So let someone at least eat some fruits. Eat grains in your diet, but you find someone taking an entire month without eating grains. Grains should be part of the diet. They stimulate our immunity. Like they also help with, you see most people, let's say, when you have maybe diabetes or what. I have a physician I know of, he usually advises people on diet. Before he even gives you medication, he will advise you on your diet, how to feed. And it is really so crucial. Let's consider the fruits, let's consider the grains, let's limit the processed foods. Let's look for life, let's do exercise. Yeah.
I have seen cases where you, for example, hold a paper or a foolscap and it will slice you. Why is the skin just like that? Like is there a way that we can make our skin tougher and not really that vulnerable? Why would the paper, for example, cut me, slice me? It has cut me multiple times, you know.
It also depends, I don't know how, but also, okay, like we said, immunity first. Now, if it has cut you several times, I think the best way is you to handle it with care.
I like that. That's just really interesting. Oh my gosh, handle that with care. Yeah. Wow, yes.
Such that you avoid the cut. Because a small wound would become a big wound.
Okay, so why would someone have a wound, but regardless of treatment, it keeps increasing? It's like you're taking medicine in, but instead of helping you, the wound is actually worsening. What is happening in that case?
Now, the medicine you're taking, mostly they are giving you painkillers and antibiotics, yeah? So they are taking the infection out of the wound, yeah, by giving you the antibiotics, taking away the pain for you to forget that there is an opening, but the opening is still there. That is why I said, please, come to the consultant. Let's treat the cause of the infection, which is that wound, and the cause of pain, which is the wound. Please come, let's treat the wound.
Okay, yes. Treatment is the only option. So say, for example, I got a bun in my kitchen. I'm just cooking or frying chips. I mean, we're going to Christmas season. We're in the Christmas season, so imagine I'm just cooking, you know, frying all this food, and then I burn myself. What is the first aid before I rush anywhere?
Now, when you get a burn, the first aid, you know, usually it is so hot. The first aid will be pouring there water, but not just water from the sink. Please get cold water, boiled water, because then we know it has no microorganisms.
But when I'm burnt, I don't have the time to think about
Please rush the fridge, or if you don't have a fridge, to your pot, when you boiled water, or to a jet can, and just pour water there to relax, because you know that pain can even cause you shock, and then after, I encourage people to buy like a banana, or if you have Vaseline, you could apply Vaseline.
Can I put Vaseline on my open wound?
Like a small wound, yes, if it is small.
A big wound?
No. You need to go to hospital, and we use Vaseline gauze. We have that Vaseline gauze, so we would put it there. Why we use it is to calm down the pain, and also it does not stick to the wound. Say if the wound is granulating tissues, and again you put the dry gauze, when you remove the dry gauze, it will automatically cause the pain, cause more bleeding, and also go away with the tissues that are granulating. And
speaking about bleeding, I've seen people who like to pick at their scabs. Are they called scabs? The black things that form on the healing wound. When someone is picking at that scab, literally defining it makes me sick. But how best can you handle? I know it's itchy. It's really, really itchy when it's healing. I've had the same. So how do we handle that? The itching and then the scab, to not pick it and make the wound bleed again.
Okay. Now talk about that. Please do not peel it off. Because it is the healing process. It itches, yes, but we encourage people, when it is itching, please just stop. Just tap. That
should be relaxing.
Just tap. It's relaxing. Give it time. Let the skin granulate maximally. Then it will even fall off itself. You don't need to, because when you peel it off by force, it will bleed again. Again, you will have a wound.
So as we wind up, how is the best way to handle blisters? Once you get burnt and then there is this balloon of water you don't want to break it, you can't sleep, you can't do, how do you handle that?
Now with a blister, remember it is inside, yeah? And you would see water out from outside. The best way is put a small hole, let the water come out. Because when the water stays in, it will make the wound deeper. Yeah, it will make the wound deeper.
Yeah.
Just let the water out, but do not peel off the skin. Let the water out and put some little, we have banam, we have some, you could go to a pharmacy and they give you a little cream to just put around until when it dries. But do not just start to peel it off. Yeah. Don't fight to get an open wound.
Yeah. All right, so I'll give you a few minutes to say your last remarks, or also to, I'll give you just a few seconds to tell. Okay, all right, so I've been advised, we actually still have enough time. Where was I worried? So let's just take a commercial break. When we return, we shall be talking more about treatment for wounds, the care, the myths we need to debunk, since we have a specialist here with us. And so stay with us, and in a very short time, we shall be back right after this. Back from the break, my name is Viola Xasera. This is NTV Medical Matters. We are supported by Bill and Melinda Gates Foundation, and this morning we are talking about wounds. What should we know about wounds? How can we aid faster wound healing? And what more is there to know in case you're struggling with a wound that has stayed on your body for so long and you have run out of hope that it might heal someday? And we have a specialist in studio. When we broke off, we were just talking about how to boost immunity, the kind of food you should eat in order to feel better, or for your skin to grow tougher so that you don't have those kinds of wounds, but also how to handle blisters once, for example, you burn yourself as you fry Christmas chicken. So let's continue, and now we shall be looking at what can aid faster wound healing. Let's begin with that.
Okay, thank you so much. Now, what can aid faster wound healing? First of all, it depends on the size of the wound. Yeah? If the wound is very big, you will need the diet, yes, but you'll also need medical intervention. You will need the vacuum-assisted closure. You will need that machine, the vac machine, to do the granulation of tissues, such that we cover up the depth of the wound. If it is a smaller wound, you will need the dressings, which have the antibiotics in, such that you get quicker healing. So you need to get treatment for the wound.
Okay,
so better.
So the key word is treatment.
The key word is treatment.
Okay, and I was asking something about if someone cannot afford treatment, what should they do? Yeah, I know you gave me some points on that, but is there any other way that a wound can heal almost naturally on its own if you don't have any support? Say you live alone and maybe you're an elderly person, what happens in that case? Or what complications can come from that if you no longer have a way to take care of that wound?
Now, like I told you before, a wound, it will depend on the size of the wound. If the wound is big, you must seek for treatment. Yeah? We have to put the vacuum-assisted closure to granulate the tissues. We've done the dressings with different dressing, like Inadine, like Actizol, but they've not helped much. So we need to granulate those tissues, especially if the wound is deep. I encourage everyone with a wound. I know you may not be having money, but please, if the wound is deep, there is nothing that will heal it unless it fills up, unless the tissues granulate, unless you get more bleeding. You see, the machine will stimulate the blood vessels to bleed, yeah? Because usually when the wound embeds the place, yeah, it also brings the tissue, yeah, that particular area becomes even black. So we need this machine because it will help improve on the bleeding. It will wake up the blood vessels, you get the bleeding, and you know where there is blood, there is life. So I encourage everyone, even when you say you don't have money, let us look at the wound.
Say, for example, you get the right treatment, you get the right support and aid for your wound. How long would you say that the wound would take to be able to heal and you get back to normal?
Now, for very big wounds, it takes about, we usually put vacuum 4 to 10 weeks. There are even those who go up to 12, because the patients I've seen with multiple wounds, like they have 3 wounds. So they will need 3 machines or 2 machines. So it really depends on the size of the wound.
And so what role does age play when it comes to the ability for someone to have a wound but also to heal? If I'm old, say someone is very old, how does that affect then how they heal or not heal?
Now also, you know, with age, it also affects someone's immunity. Yeah, it comes with, especially if someone has not use the proper diet, they do not do exercise, their mobility is really minimal, they stay so long in one place, it also risks their healing. So when they get wounds, we encourage them obviously to be on diet and also to do some exercise such that it can help on the wound to heal faster.
Well, there are some foods that I've had that actually create or maybe will make your skin very, very delicate, that when you get a wound it will be very difficult to heal. Are there foods such as that? What I heard is that fats.
Yeah, obviously fats. Most people can't do away with oil. Most people cannot do away with, you find there are people who eat oil every day. In everything they eat, they must fly, yeah? You find the people who want to eat chicken every day. Yeah, they want to eat, and they do not want to do the roasted one. They want the deep-fried one, yeah? Deep-fried chicken, deep-fried fish. So ideally, we should also watch out on the diet for life. Yeah, if
So
you want to
should we
live up
avoid
to
fats?
80 years, 100 years, like myself, I want to live up to 120 years. I started looking onto my diet so well,
Yeah.
and avoiding so many oil things.
So in that case, we need to avoid oil.
Yeah, you need to balance up, avoid oil, avoid the sugars, take honey, yeah, watch out.
Okay, so what signs can someone look out for that will indicate their wound is getting an infection, even if they have their own treatment?
And now, first of all, even when you're on treatment and the wound is still oozing out pus, yeah, that's the sign that it is infected. The wound still smells, it is a sign that it is infected. The bleeding is minimal, yeah, it is a sign that it is infected. The color of the wound matters. You see, some wounds would get some black, yeah, around it. That is a sign that the tissues there are dying. So do not wait to get dead tissue. Please rush for help, yeah. Then also the size of the wound. You see, if the wound is healing, it will reduce the size. But when it's not reducing the size, it is still deep. Please, it is not healing. Do not let be dressed for a month, 2 months, 3 months when you still have. And it's also good to take pictures. When someone says they can dress you and you heal, take the picture before. Every time you go for dressing, take a picture. And then say, so I do not see this healing. Then please consult us, we shall help you.
What mistakes are usually made when it comes to treatment of wounds? And that could be at home, but it also could be by some of the doctors.
You know, in medical, there are specialties. You find that the people who are working on the, let's say we have different departments. We have the physicians. In medical, we also have the people who work on the eyes, yeah, the ENT physicians and surgeons. We have those for the heart. So please, do not work on everything. If you try and you see that it's not getting better, please be good enough to refer the patient.
So how would you define a non-healing wound? And is there a case where then it ever reaches the level where it says, I've had enough, now I need to heal?
Yeah, obviously, when we treat wounds, I have treated very big wounds. I have treated wounds which were at the edge of amputation. And now the patient has their limb, yeah, has their arm or has their limb. Those took me like 2 to 3 months. And our treatment is weekly, yeah, it's weekly, it's not every day. When I set it up, it will take a week, 5 to 7 days, then we change, yeah. But then when you treat a wound for 3 with no more dressing or whatever they are using, 4 months, 5 months, it's not getting better. A year, no one should have a wound for a year, ideally. It's too big, then it has become chronic. So you're risking your life to other issues like amputation. They can, I will say cut off, they can amputate or cut off your arm or your limb, yeah, or your toes. So do not look for disability when you can actually heal.
We spoke to a diabetic patient on this show, and she had her leg amputated. So as you speak, I'm thinking of her. And she, when she first got, why they had to amputate her leg is because she stepped on a metal, I think a nail, and she didn't hear it. She didn't feel it. She did not feel it because I guess her senses were no longer there. Yeah, so when someone has, for example, diabetes, I've seen people have those wounds, really, I have. What is the care that is supposed to be done for people like that, honestly? You have diabetes and your toes are beginning to act up. What do you do?
Now, I encourage people who have diabetes, most times they lose sensitivity in that place. They can even step on fire and they do not feel that it's fire. But when diabetes is properly treated, it does not reach that extent. I encourage people with diabetes to look for proper treatment from physicians. A physician has measured in those illnesses like the diabetes, the hypertension, yeah? Do not take some illnesses to people who are not qualified to treat those illnesses. Even in Mulago, physicians are there. They are everywhere in government hospitals. Go to a government hospital, get a physician. Let them give you proper medication to manage your diabetes. You will not lose your senses to that extent. That's what I encourage people to do. Get proper treatment. After
she got an amputation, she actually fell down, and that same wound hit the ground. So it begs the question: at what risk, at what level does amputation actually become a risk to the person who has had it?
Amputation is really a risk because imagine having walked from childhood, and then you're an adult, and they take off your body part. It's really psychologically a torture, yeah. And you can never be the same again, Even when they give you an artificial leg, it can never feel like the one you have. So I encourage people to fight that, to fight complications for a wound. If we can do treatment and you get better, let's heal. Let's seek for medical advice. Yeah. Let's not reach the extent of being amputated. Yeah.
What is the farthest a wound has ever gone that you've ever treated where you felt like this now is just something else and you almost lost hope about it?
I had one client who already had an amputation from somewhere else some years back. Then when they came to me, they had wanted to amputate his second leg. So he said, no, I cannot lose both. So when he came, we tried to rescue this leg, though the toes had already been eaten up. So we had to cut off the toes to save these other parts. So he lost the toes, but we saved the other parts. At least he got that fisher toes now. Yeah.
When someone is undergoing treatment for a wound, what signs can you see, or should they look out for, whoever is watching, that this wound might not be progressing as I thought? Because sometimes it's very easy to feel like, since I'm getting medication, I'm living my life, I think I should be okay, How do you get to determine, I think something is not going well?
Yeah. Now, like I told you, if you have a wound and you go somewhere for treatment and you start the dressing, they might be maybe daily dressings which are really hectic, because moving to a clinic every day for dressing, it's really hectic. Or they might be after 3 days. If you go to a clinic with your wound, I encourage everyone with a wound to take a picture of your wound. So if you dress 2, 3 times, 5, 6, keep taking each time you go, such that you can see the change, or you see when there is no change. Like I said, if you go to a clinic when the wound has pus and you dress 3, 4 times and it still has pus, when it also smells, then say it is swelling, then it has brought the black patches all over the wound, that wound is not healing. So talk to the doctor or whoever is nursing the wound, but please, is there any further treatment I can have such that I can heal and go back to work. Yeah, other than dressing the wound for a year, it's not there. When a wound gets proper treatment, it cannot take more than 3-4 months.
Okay. So we now just want to understand a bit about your work as a person. I know working on wounds, for me, just listening to you, I do not imagine myself doing it. Okay. So let me ask you, what are some of the challenges that you've faced as you've done this work? And I admire you because you said that you're doing this work and sometimes you help the people even when they're not standing very well financially. Yeah. So what are some of the challenges that you've encountered on this journey?
Now the challenges, I started doing wounds when I was still in the training. I loved wounds from that time when I was in the training.
Why did you love wounds?
It could make me happy when someone has a wound and I nurse them, and the wound disappears.
Oh, it's recovery.
I would really feel okay. And also when someone has a smelling wound, and I would nurse them, and they stop to, they eat food. They start to eat food because you know when the wound is smelling, someone cannot even eat.
That's true.
Yeah, and I remember way back before I attended this training in VAC assisted closure. I did this training outside Uganda. I didn't do it from here. We used to use, smudge fragile metronidazole, yeah? People call it the yellow tablets. And we used to put onto the wound. That is the training we had back then. So what made me love wounds is when someone has a wound, maybe it's burn or any other wound, and I do that, see the next day the person walking with less pain, the client happy, it would make me go. It's passion. I really treat wounds with passion, and even now I have worked on so many people. I can't mention names, but I've worked on so many. And what makes me happy is when I meet them walking, I meet them sitting, like if they had bed sores. Yeah, like there is a lady I worked on. She had an accident, a terrible one, so she lost one arm on the scene. Then we saved one, and also we saved the limb. When I find her walking, it really makes me happy. Yeah, so it's really passion.
No challenges at all?
Challenges I face is I do not, most people say, don't they smell? Do you eat meat? My dear, I can go have my lunch after very terrible wounds.
That also runs through my mind. Like,
but you know, when we are working on them, we put on protectives. I put on the mask and what. But you know what keeps me going is if myself, the smell is too much, what of the person who has it throughout? How are they feeling? So my urge, my encouragement is to set that person free from that smell. That makes me happy.
Have you encountered a person that you had to treat and had what is usually referred to as lugezi-gezi? They gave you trouble treating them?
Yeah. Many patients, most times they are depressed. Yeah. So as a medic, you know, being a medic is being kind. You cannot separate that with kindness. Yeah, they act like that, but you know, I usually look at them and know that they are troubled. Obviously, someone is depressed. Yeah, so I usually calm down and talk to them nicely. I love praying. I also pray for them. So when someone is rude and they find that the person they are dealing with is calm, automatically they will calm down. And even when they don't calm down, I still treat them, and when they heal and go, I'm happy. Even when they never call and say thanks, I have done my job. Yeah. You
spoke about smudging fragile onto the wounds when you were training, but so looking back at that and where we are now, what are some of the advancements that have been made in that, I wouldn't just say medicine, it's broad, but in the treatment of wounds, what advancements have you noticed that have been made, and that's worldwide?
Yeah, now worldwide, because I have attained many trainings outside Uganda for wound care. Like I was in China, also learning more about wound care, and they've made so many dressings. Apart from the vacuum, because vacuum is usually for those big wounds or small deep wounds that need it. Not every wound needs vacuum. So we've seen different dressings, whereby you put a dressing and it will stay on for 5 days, like the Inadine. 3 to 5 days, depending on how the wound oozes. The patient doesn't have to come to the hospital to be dressed or clinic to be dressed daily. You use that and the patient goes for 3 days, they do their work, then they come back. It's comfortable. Then we also seen Actzob. It's for wounds that smell a lot. Yeah. So you put it, it is medicated and it releases the medication slowly to the wound. So as opposed to using the smashed fragile, we now have so many dressings that we can use that really do good for the wounds. Yeah.
You spoke about China and I got interested, you know, they tend to have a lot of traditional medicine.
Yeah.
I'm actually speaking on behalf of our viewers, our Ugandans, including me. Some of us may really prefer or want to, you know, lean towards traditional medicine for all of our complications, really, not just wounds. Did you ever encounter any medicine that you thought, wow, that's really interesting to be used for wounds?
Yes. There's a group of people, Chinese, that I discussed with. They have some herbal medicine. They wrap it in a gauze, yeah, and they say you put it on the wound for 5 days, yeah, and then you change. You keep changing, but I told them I will still study it further. Yeah, I'll still study it further. Then I can see maybe if it can work.
Okay.
But you know, personally, I know most herbal can work maybe, but it is not the dosage.
Yes.
The dosage is not like
I saw that with the COVID, where you just drink a jerrycan of garlic.
The dosage, no one knows the dosage. And no one knows the risk of the dosage. Maybe for them who research about it, no. The risk of the dosage to the kidneys, to the liver. So that disturbs me.
Oh yeah.
Yeah.
Okay. Have you seen one in Uganda? Have you seen one in Uganda?
The dressing, the herbal?
Yes.
There are so many.
Yeah.
There are so many, I hear of so many who say they treat wounds using herbal medicine, but I have not given it time to really navigate more.
Okay. What are some of the myths that you know about wounds that you'd love to debunk on this show today, now that you have the opportunity to actually talk to our viewers? The myths.
Using salt.
It's a myth? I thought it works.
No. First of all, salt is painful. And it can make the wound deeper, go deep. You do not have to use salt. That salt is not diluted. It's so conk. Do not use it. Yeah. Then burning. Already the wound has pain, enough pain. And again, someone gets something to burn the wound more. I find that so painful. Then also someone telling you you can live with the wound for years. No, you're supposed to be wound free.
We've heard about wounds where you can get dog fur and just put there, or rabbit, or, you know, haven't you heard of that? You pluck fur from a dog and
those are all the herbals. Those are all the herbals.
Put on the wound.
Those are all the herbals.
Okay.
And I don't know much.
Okay. And so now that you're here, just talk to our viewers in the last few remarks about what would you love them to know as I let you go.
Okay. Thank you, our viewers. Now, as we wind up, I request everyone with a wound, instead of treating it on your own, please consult. Please consult. Consultation is free. I'll give you my number. Send the picture of the wound. If you need to come, I'll tell you, come, let me look at the wound and let me advise you, such that you're wound free. The goal is being wound free. Let's have a wound free Uganda. Okay? Let's limit amputations.
Okay. Before you give out your number, quickly, how can someone deal with scars once the wounds are gone? Say we've worked with you, the wounds are gone. What do I do for the scars, for the beautiful ladies out there?
Now for the scars, we have a dressing that we put on the scars, and it compresses it. Yeah. So if you have any scars, maybe you had cesarean section and you have a scar, maybe you had in surgery and you have a scar, please consult. We have some dressing that can compress the scar and it goes away.
Okay.
Yeah.
All right. Thank you so much. It was really good to have you here, and thank you for your insightful remarks here on the show.
Thank you,
and we shall see you again. And to you, dear viewer, thank you so much for also watching, for creating time. Oh, before I forget, could you please give out your contact? These people will need to contact you. You've been calling them to come to you, so quickly do that.
My contact, MTN 0782885855. I repeat, MTN 0782 885855. My Airtel is 0750 881509. I repeat, Airtel 0750 881509.
And who are they looking for?
Consultation.
Okay.
Yeah. When you have a wound, please talk to me.
No, who do they look for?
You're looking for specialist Biogero Diana.
Okay, Diana.
For wounds.
All right. Thank you so much for your time.
Thank you, sir.
That is how you will get in touch with her. Also, our episode, you can find it on YouTube. In case you didn't catch that contact, you'll be able to go there and find it there at NTV Uganda YouTube. And Viola here, I will leave you here. Thank you very much for being a part of this NTV Medical Matters episode. And I wish you a very, very happy Christmas as we're headed there. And until next time, just remember, we are supported by Bill and Melinda Gates Foundation. That's how we are able to bring this information your way. I wish you a very lovely Christmas, and I will see you next time.